Hi, this is Ellie from DC Line, powered by MeyerDC. We're here today with Dr. Perry Nickleston of Stop Chasing Pain and RockTape. He's been kind enough to visit our headquarters to teach an FMT 1 and 2 class. So I know you just got done with teaching a whole room of new practitioners. What's some of the most exciting stuff while you're kind of introducing them to kinesiology?
Well, first of all, thank you so much for having me. It's wonderful
Thanks for being here.
Be here. Yeah, well, I'm very familiar with Meyer, and I've been using them for many years as a chiropractor myself, so it's really great to kind of come out and see where all the magic happens, ground zero. So thank you for having me.
Yeah.
But yeah, it was great. We had a really awesome turnout for level 1 today, packed house, I think 25, 26 people there.
Mm-hmm.
And all different skill sets, which was great to see. We have massage therapists, chiropractors, PTs, athletic trainers, just people that are really wanting to learn a new tool they can bring into what they're doing to help their patients and their clients. And I think that that's what's so special about this, is that everybody has the same goal.
Yeah.
To be better at what they love to do and find something different, unique, but very effective that they can go back and start using right away. So it's really great when I first start, because it's a new thing for a lot of people to see kind of light bulbs go off.
Yeah.
When they start to apply it to themselves and they're like, wow, I just can't believe how much better I feel. Or what's really great is they start to think about people they're going to use it on.
Yeah.
Like they say, oh, I've got this person, I know it's going to be great for him. Or a lot of times it's just their own loved ones, their family members, that they want to go back and help. I've been doing this for, it's going on 4 years now,
mm-hmm.
and it never, ever stops being awesome when I teach.
Yeah, I mean, I could just see people when you had them demonstrate on themselves, get into the movement. Like you said, a light bulb went off, and they're like, oh, that's why it feels this way. So much of the treatment that they're doing with people, they're not feeling the movement, so you really make them learn again that way too.
Yeah, I'm a big believer in learning through movement. So it's a fascial movement taping course. So RockTape really prides itself on trying to get people to move better,
mm-hmm.
to be stronger, go harder, go longer. And the tape is very effective, and it's a safe tool to use. Across all demographics, from young to old, active, inactive, all across the board.
Yeah, I think it's interesting to see so many people who are learning really understand that the whole population of the world can be affected by tape, not just specialty athletes, for instance, or CrossFitters. Although, of course, there are people who benefit too.
Yeah. So I think the mission for RockTape, and my personal mission of Stop Chasing Pain, is to get people to move more. Move better. It's always helpful, but to me, sometimes any more movement is always better.
Yeah.
To do that. So tape is a great way to help them, if they're hurting, to not hurt so much when they move, if at all, or to not be so fearful of movement. And the tape is very powerful that way. So one of the tenets that we teach is, if we can change how you move, we can change your life. And there's always some type of movement difficulty with pain, right? And if I could put tape on you and get you outside and get you smiling and laughing and having a good time again, that's pretty powerful.
Yeah. So I know you're teaching. What other stuff is up and coming for you?
Well, I always love teaching for RockTape,
mm-hmm.
so I teach for them on a regular basis and have for many years. So, but I also teach a lot of other movement-based courses. My own company, Stop Chasing Pain, I have workshops all over the world that I teach a 2-day course in on movement, and I'm honored that I get to teach at a lot of health and fitness conventions, chiropractic conventions, physical therapy conventions, and just kind of fitness, overall well-being conferences.
Where can we see you this year at any of the upcoming conventions?
Well, I'm going to be out of the U.S. a lot this
cool.
year, which is cool. So it's really kind of awe-inspiring for me sometimes to think, wow, people actually follow me from outside the U.S.
Yeah.
So I'm going to Australia in 2 weeks for their biggest fitness conference there and teaching a workshop. So I'll be there for 2 weeks. And then I'm going to Singapore and Canada. Got Hong Kong, got Taiwan. I got some really cool places to go.
Yeah, sounds like it.
Outside of the U.S., but I teach at quite a few of them in the United States too. This year I always teach at the Arnold Fitness Classic in Columbus, Ohio.
Mm-hmm.
So I was just out there for that one. 'Cause I'm a bodybuilder at heart. That's where I started from, and I got into chiropractic and more movement based stuff because I just kept getting hurt, driving the iron.
Yeah.
And so that's kind of like my second home. All my offices and my centers are inside fitness centers.
Oh, okay, cool.
Yeah. So it's a perfect mix of movements and with the taping and the type of therapies that I do. So I've always got my finger into something because there's never just one way to help someone. So I try to learn as much as I can from other people, bring it on in, and be better at what I love to do. So teaching is awesome. Every time I teach, I learn a little bit more because I take feedback from the audience and learn a new perspective. Every time you teach to a group, you kind of have to teach in a different way. So there's always some new takeaway when you're open to learning it, if that makes sense.
Yeah, definitely. And then I know you have exciting news too with your book coming out.
Yeah, thank
More
you.
stuff.
Yeah, so I've been working on this book that seems like forever, and a lot of people that follow my work really push me to publish something. And I finally decided I better listen or they're going to actually hurt me if I don't do it.
They just want all of your good ideas in one place.
Yeah, well, I had to be ready for it, and I was out on the teaching circuit for a couple of years just to see if this message would resonate with people, and it seems to have done that, which certainly really means a lot to me. But yeah, my book is coming out in January. It's called Stop Chasing Pain, and that's the big one. There's a long subtitle after that I don't remember, but. It's you can go and buy it on Amazon right now. It's on pre-sale. But basically what that book is it's a culmination of everything I've been teaching over the last 20 years of being in the health and fitness world. So it's based on movement and helping people do some things that can make them feel significantly better, a lot faster. So Stop Chasing Pain means that you stop chasing it, right?
Yeah.
I mean, you move, you feel better, and get your life back.
And this book, is it for practitioners and patients? Really?
Yeah, I joke when people say who's it for. I jokingly say that if you're alive on this planet and you're drawing a breath and you move, this book's for you. So I purposely wanted to make it where it could go across the board.
Okay.
So it's for lay people, it's for clinical, it's for athletes, just anybody that wants to learn more about their body and not be fearful of their body. Or when you're in chronic pain, you lose hope a lot, and then sometimes you give up. And I've been there, so I know what it's like. That's why I wanted to put this book out there, but I wanted to make it simple for people to do. And I think it's very important for my world as clinicians too. Sometimes we get so wrapped up in things, we make things more difficult than they have to be. It's kind of human nature to overcomplicate everything. So I wanted to try to make it simple and write the book that I wanted to read. And I think that resonated with others because people are already buying it, which is cool, which is really nice. But
you just found out that it was top of the pre-sale list, right?
Yeah, I was so excited. I woke up this morning when I got here, and then my website guy said, "Oh, you like this home page?" And he's like, #1 new release. And I'm like, "Dude, I don't know if we should put that up there, and he said, "Dude, it's true." Like, I'm like, "Really?" I went on Amazon and I saw it. I'm like, "That's awesome."
Yeah.
And so it really meant a lot to me because this is something that I truly, honestly believe that these things will make a big difference in somebody else's life. And there's nothing more rewarding than that for me. It's a lot more work, honestly, than I thought it was going to be. But if you want to make a difference in the world, it takes work.
Yeah. And I think everything you're saying is so much of the message of chiropractic, health, fitness, wellness. Everyone just wants to help other people improve.
Yeah, and I think that's what's wonderful about coming to these things and teaching to different people. I always tell them that there's really no one perfect method. There's no one thing nothing is really better than another one. It just depends on, is it the right thing for this particular person at the right time. So we all have the same mission, I think, is to help people. And when you go into something like this and all different disciplines are working together and asking questions and learning from each other, I always try to encourage that people in one discipline to sit with or talk to other disciplines, because you can have a little bit of a different take on the body. Because when you're kind of stuck in your paradigm or the way you do things, you kind of only see what you're used to seeing, right? You may miss some things. And I taught them there today about being curious, right? Just looking a little bit, tilt your head a little bit and say, is there something here that maybe we can try a little differently? And I think that's where big miracle type changes happen.
Yeah, that's where the magic happens.
That is where the magic happens, or what I call a mojo. Mojo means magic.
Perfect. Well, thank you so much, Dan, for sitting down with us. You can visit stopchasingpain.com to listen to Dr. Perry's podcast series. You can catch his articles on DC Aligned at news.meyerdc.com. And it's been a pleasure talking to you.
It has certainly been an honor for me. Thank you very much.
Thank you.